Welcome to the deep dive. Today we're tackling something that might be closer to home than you realize if you share your life with a cat: diabetes.
Hmm.
And here's a stat that might, well, raise an eyebrow right away. Around 1 in 200 cats will develop this condition.
Yeah, it's surprisingly common.
So we've sifted through the details to bring you the essential information, kind of your shortcut to understanding feline diabetes without getting too bogged down in, the jargon.
That's the plan. Our goal in this deep dive is really to pull out the crucial knowledge about feline diabetes from the materials we have,
Right.
specifically with you in mind.
Right?
We want to make sure you feel informed and confident about this condition. We'll be exploring the key aspects, the definition, causes, signs, drawing from the pasted text you shared.
Okay, great. So let's get right into it then. What exactly is feline diabetes?
Well, at its core, it's a metabolic disorder.
Metabolism, like how the body uses energy.
Exactly. Think of it as how the body converts food into energy.
Yeah.
And in diabetes, this whole process gets disrupted, especially when it comes to carbohydrates, but also fats and proteins too.
Okay.
The fundamental problem lies with insulin. That's the hormone. Either the body isn't making enough of it or it's not using it effectively. Sometimes it's a bit of both.
And the sources mention different types. Type 2 seems to be the most common one in cats.
That's correct, yeah.
Yeah.
Type 2, sometimes called non-insulin dependent diabetes mellitus, is definitely the most frequent form we see in cats.
Okay.
The main thing here is that the pancreas, that's the organ making the insulin, it just isn't secreting enough. Or maybe it's not doing it at the right time to meet the body's needs.
Okay.
And what's really interesting, actually, is that many cats with this type 2 can often be managed without needing insulin shots.
Really? Without insulin?
Yeah. And they're also generally less likely to develop a really serious complication called ketoacidosis.
Less prone to ketoacidosis. That's definitely good news. So if they're not necessarily completely lacking insulin, what's the underlying issue then?
It often comes down to something called insulin resistance.
Resistance.
Yeah. Imagine your body's cells have, like, locks on them, right? And insulin is the key that lets sugar glucose in for energy.
Mm-hmm.
With insulin resistance, these locks, mainly in the muscle, fat, and liver tissues, they become less responsive to that insulin key.
So the key doesn't quite fit anymore.
Sort of, yeah. It means glucose can't move easily from the bloodstream into these cells, so it builds up in the blood.
Causing high blood sugar levels.
Exactly. That's what we mean by hyperglycemia.
Okay, so hyperglycemia, high blood sugar. What happens then? What's the knock-on effect in the cat's body?
Right, so when that blood glucose gets too high, the kidneys, they sort of kick in to try and remove it.
Filter it out.
Yeah, filter it out of the blood, and it ends up in the urine. We call that glycosuria.
Okay.
But here's the thing. Sugar attracts water, so it pulls extra water with it into the urine.
Leading to more urination.
Precisely. That's osmotic diuresis, increased urination. And because the cat's losing all that fluid, they get really thirsty and start drinking more.
That's the polydipsia you mentioned.
That's the one. So you get polyuria, more peeing, and polydipsia, more drinking.
Okay.
And even though the cat might actually be eating more, that's polyphagia, they often start to lose weight.
Why's that? If they're eating more.
Because their cells aren't getting the energy they need from that glucose, remember? The key isn't working properly.
Right, the sugar's stuck in the blood.
Exactly. So the body starts breaking down fat for energy instead. But this can overwhelm the liver.
Leading to liver problems.
Potentially, yes.
Yeah.
A serious condition called hepatic lipidosis, where fat just builds up in the liver. And it can also lead to the production of these things called ketones.
So it's like a whole cascade effect, really affecting multiple parts of the body. The source material actually breaks that down. Which systems get hit the hardest?
It does. We're looking at the endocrine and metabolic systems, obviously, with those electrolyte imbalances, things like sodium, potassium getting out of whack, and potentially metabolic acidosis.
Okay.
Then there's the hepatobiliary system, that's the liver and gallbladder. Big impact there from hepatic lipidosis, which can even lead to liver failure in severe cases. And interestingly, the nervous system can get involved too, leading to peripheral neuropathy.
Nerves outside the brain and spine.
That's right. And of course, the renal and urologic systems are affected by all that increased urination, which also makes them more prone to urinary tract infections.
Yeah, that makes sense. The notes also mention something quite striking, that jaundice, the yellowing, is more common in diabetic cats compared to dogs.
It is, yeah.
Yeah.
That's a noticeable difference. This higher prevalence of jaundice often points straight back to those underlying liver issues we just talked about, like the hepatic lipidosis or maybe cholangiohepatitis,
Right.
which, like you said, just seem to pop up more often alongside diabetes in cats than they do in dogs.
And then there's that other sign, less common but very specific, the plantigrade stance. What exactly does that look like?
Ah, yes. That's a really distinctive sign of that diabetic neuropathy we mentioned.
Okay.
You might notice the cat walking with their hocks, that's kind of like our ankles, much closer to the ground than usual.
So walking sort of flat-footed on their back legs.
Pretty much, yeah. It's
Yeah.
a subtle change, but it's significant if you see it, a change in their gait.
Okay, so we've covered what's happening inside the body. What are the actual signs an owner at home might see that should make them think, maybe I should get this checked out?
Well, in the early stages, it might surprise you, but being overweight or obese is actually quite common.
Really? Not weight loss initially?
Not always, no. Sometimes you see obesity first. You might also notice a loss of muscle mass along their back. We call that dorsal muscle wasting.
Okay.
And their fur might change too. It can become unusually oily or greasy, and maybe they have more dandruff than usual.
An oily coat? That's not something I'd immediately link to diabetes.
Exactly. Which is why it's so important to know about these less obvious clues.
Yeah.
Then as the condition progresses, the more classic signs usually start to appear.
Like the drinking and peeing more.
Yes, the polyuria and polydipsia. Also, a noticeable increase in appetite polyphagia, even though they might actually be losing weight by this point. Lethargy, too. Just a lack of energy. They might seem depressed or withdrawn. And in some cases, you might see vomiting and then eventually maybe even a complete loss of appetite later on.
Okay, so what's actually causing this? What's behind it all? Why does a cat develop diabetes in the first place?
The source points to several things, several contributing factors. There could be a genetic susceptibility.
So some cats are just more prone.
Seems that way, yes. Also, the buildup of an abnormal protein called amyloid in the pancreas that can play a role.
Yeah.
It's similar to what's seen in some types of human diabetes.
Interesting.
Inflammation of the pancreas, pancreatitis, that's another potential cause. And certain pre-existing conditions, like hyperadrenocorticism.
That's Cushing's disease, right? Overactive adrenal gland.
Correct. That and also acromegaly, which is excess growth hormone, those can increase the risk.
Okay.
And finally, some medications are known culprits, particularly glucocorticoids. Those are steroids and progestogens, which are synthetic hormones.
Steroids and certain hormones. Got it. And the big risk factor that keeps coming up, especially for type 2, is obesity.
Absolutely. That link is really strong in cats. Carrying excess weight significantly increases the risk of developing that insulin resistance we talked about.
So keeping your cat lean is pretty protective then.
It's hugely important. You can almost think of it like every extra pound makes their body less and less responsive to its own insulin.
Right. Okay, now let's say a vet suspects diabetes. What does the diagnostic process look like? How do they confirm it?
Well, there's several key things they'll consider. First, they need to rule out other conditions that might look similar.
Like,
One is renal glycosuria. That's where glucose shows up in the urine because of a kidney problem, not high blood sugar itself. But usually, you don't see the persistently high blood glucose or weight loss with that.
okay,
Another big one in cats is stress hyperglycemia.
just from the stress of the vet visit.
Exactly. Cats can get a temporary spike in blood sugar just from being stressed at the clinic. But again, this usually isn't accompanied by the increased drinking, urination, or weight loss.
Oh.
And a specific blood test, the fructosamine test, will typically be normal in cases of just stress hyperglycemia.
Okay, so that fructosamine test helps differentiate. What about the standard blood work and urine tests? What are vets looking for there?
Right, so blood work will typically show significantly high glucose, usually over 150 milligrams per deciliter.
Okay.
They might also see elevated liver enzymes, things like SAP, ALT, AST, that could indicate stress on the liver or maybe actual liver damage. High cholesterol and increased fat in the blood, lipemia, those can also show up. And electrolyte imbalances can happen too, like changes in sodium, potassium, phosphorus. In really sick cats, you might see high sodium, low potassium, low phosphorus.
Serious signs.
Definitely. And if the cat's in ketoacidosis or severely dehydrated, the levels of total CO2 or bicarbonate in the blood will likely be low.
And the urine.
The urine sample is key. It will consistently show glucose, that glycosuria we talked about. Ketones, those byproducts of fat breakdown, are less consistently found in diabetic cat urine compared to, say, diabetic humans, but they can be there.
Okay.
And the urine-specific gravity, which measures concentration, is often low because of all the extra water being pulled out.
So basically, high blood glucose plus glucose in the urine, along with the clinical signs, is a pretty strong indicator.
It is, yeah.
Yeah.
Especially when you combine it with those signs like increased thirst and urination. The fructosamine test is really helpful too.
Remind me what that shows again.
It gives a picture of the average blood glucose levels over the previous, say, 2 to 3 weeks. So it's not thrown off by a single stressful event like the vet visit.
Gotcha.
In diabetic cats, these fructosamine levels are typically quite high, usually above 350 micromoles per liter.
Okay.
And in cases of ketoacidosis, another blood test often shows something called a high anion gap. Now, imaging like X-rays or ultrasound isn't always needed for the initial diagnosis.
But that can be useful.
It can be, yeah, especially
Gotcha.
for checking for other problems at the same time, particularly in cats showing jaundice, to get a look at the liver and pancreas. Sometimes a liver biopsy might even be considered in those cases.
Right.
Interestingly, though, if you were to look at the organs after death, often there aren't obvious large-scale changes, but under the microscope, you might see damage to those insulin-producing cells in the pancreas, or those amyloid deposits we mentioned.
Okay, so diagnosis confirmed. Now, what are the strategies for managing feline diabetes? How do we treat it?
Well, the approach really depends on the cat's condition. Is the cat relatively stable, alert, hydrated, eating? Or are they in a more critical state?
Right.
Stable cats can usually be managed at home as outpatients. But cats who are really sick, especially if they have ketoacidosis, they usually need intensive treatment in a veterinary hospital first.
Makes sense.
But regardless of the starting point, maintaining a consistent level of daily activity can actually be quite beneficial.
And diet. That seems to play a really, really significant role, doesn't it? Especially right after diagnosis.
Oh, absolutely. It's huge. Research has shown that feeding an ultra-low carbohydrate canned food can be incredibly effective.
How effective?
Well, get this. In newly diagnosed cats, switching to this kind of diet can lead to diabetic remission in a really high percentage, somewhere between 70 and 95%.
Wow, 70 to 95% remission just from diet. That's amazing.
It really is a potential game changer. So for a newly diagnosed cat, just changing the food could potentially reverse the condition entirely for the vast majority. Of course, if you do make a big dietary change like that, it's crucial to monitor their insulin needs very closely because they might drop significantly or even disappear altogether.
Right. You wouldn't want to give too much insulin then.
Exactly.
Yeah.
And generally, it's best to avoid those soft, moist foods in pouches. They can cause bigger spikes in blood sugar after eating.
Good tip. Okay, so diet is key. What other important things do owners need to know for managing their diabetic cat day to day?
Client education is vital. Owners really need a good understanding of the daily feeding schedule and the medication schedule, if insulin is needed. They also need to learn how to monitor their cat at home. That might involve things like checking urine glucose, for example.
Okay.
And it's absolutely crucial they can recognize the signs of hypoglycemia, that's dangerously low blood sugar, and know exactly what to do if that happens, like having corn syrup on hand.
Right, emergency plan.
Exactly. And of course, knowing when to call the vet if things aren't right. Keeping a detailed pet health chart can be super helpful too.
What would they track in that?
Things like urine test results, the insulin doses given, the cat's weight each week, maybe appetite and water intake. It really helps track progress and spot trends.
Good idea.
Oh, and one other point. For female cats that haven't been spayed, assuming they're otherwise stable, we generally recommend spaying them.
Why is that?
Because the hormones produced during their heat cycles, especially progesterone, can really interfere with insulin and make managing the diabetes much more difficult.
Ah, okay. That makes sense. Now, when it comes to medications, insulin injections are still the main treatment for most cats, right?
Yes, for the majority of diabetic cats, insulin therapy is definitely the cornerstone of treatment.
And there are different types.
There are, yes. They mainly differ in how long they act in the body.
Yeah.
There's pork lente insulin, often sold as Vetsulin. That's an intermediate acting one, usually given twice a day.
Okay.
Then there's protamine zinc insulin, or PZI. That's a longer acting option, often given just once a day, though some cats might need it twice daily. And another common one is Glargine, brand name Lantus. This is also longer acting, but it provides a more consistent sort of peakless effect over 24 hours.
Peakless.
Yeah, less of a big spike and drop in effect. It often works really well in cats, especially when you combine it with that low-carb, high-protein diet we talked about. And Glargine has also been linked to those higher rates of diabetic remission.
Interesting. And the starting dose?
It's usually around 2 units per injection for these types, but the vet will figure out the precise dose for each individual cat, of course.
Naturally. What about oral medications? Pills, are those ever an option for cats?
They can be, sometimes. There's an oral medication called glipizide. It might be used in cats with uncomplicated type 2 diabetes who haven't had ketoacidosis.
How does it work?
It basically works by stimulating the pancreas to release more insulin. The starting dose is usually given twice a day, and the vet might increase it if needed.
But are there downsides?
Yes, it's important to know it still requires the same careful monitoring as insulin injections. And there are potential side effects, including hyperglycemia, liver problems, sometimes causing jaundice, and vomiting isn't uncommon either.
So not always the first choice, then?
Generally not. Insulin is usually preferred.
Okay.
There's another oral drug, carbose, but it's even less commonly used in cats.
Okay. Are there any medications that should generally be avoided in diabetic cats, things that make it worse?
Yes, definitely. Those glucocorticoids, steroids we mentioned earlier,
Yeah.
big ones to avoid if possible.
Right.
Also, magistral acetate and progesterone, they all increase insulin resistance, making the diabetes harder to manage.
So if a cat needs steroids for another reason.
It gets tricky. Oral prednisolone might be a slightly better choice than the long-acting injectable forms, but it still needs careful management and likely insulin dose adjustments.
Okay.
Also, vets need to be cautious with hyperosmotic agents, drugs that can pull extra fluid into the bloodstream in cats who are already dehydrated and have high blood sugar.
Got it. And drug interactions.
Yes, always a concern. It's crucial to tell your vet everything your cat is taking, especially with oral hypoglycemics like glipizide. Other drugs like NSAIDs or certain antibiotics might affect blood sugar levels. Always best to double check.
Good advice. So once treatment starts, how do vets and owners actually monitor how well it's working? How do you know if the diabetes is well managed?
Well, interestingly, those traditional glucose curves where blood sugar is checked many times over 12 or 24 hours at the clinic, they aren't always the most reliable tool in cats.
Why not?
Because of that stress hyperglycemia we talked about. Just being at the clinic can skew the results.
Ah, right. So what's used instead?
Monitoring glucose levels in the urine at home can be a useful way for owners to get a general feel for things.
What are they looking for in the urine?
The goal is often to see just a small amount, maybe traced to 14% glycosuria, right before meals and insulin injections.
A small amount. Why not aim for 0?
It's a bit of a safety margin. If the urine is consistently negative for glucose, it might mean the blood sugar is getting too low sometimes, increasing the risk of hypoglycemia. So a tiny bit of glucose spilling over is often considered acceptable.
Okay, that makes sense.
And then that fructosamine blood test we mentioned earlier is really important for tracking longer-term control.
Right, the average over weeks.
Exactly. The goal is generally to keep those levels below 400 micromoles per liter. Vets usually check it monthly at first, and then maybe every 3 months once the cat is stable and well controlled.
Okay.
But honestly, one of the most important indicators is just the owner's careful observation of their cat day to day.
Watching the clinical signs.
Yes. How much are they drinking and urinating? What's their appetite like? Is their weight stable? Are they active and bright? These are really crucial clues about how well the diabetes is being managed.
So owner observation is key. Now, looking upstream, what can be done to actually prevent diabetes from developing in the first place?
The absolute most important thing is preventing or correcting obesity.
Back to weight again.
It's critical. Maintaining a healthy weight through a balanced diet and encouraging regular exercise or play is just crucial for cats.
Makes sense.
And also, avoiding the unnecessary use of those medications we talked about that can increase risk, like glucocorticoids and magistral acetate whenever possible.
Right. Are there potential complications down the road, even if the diabetes is managed, things owners should be aware of?
Yes, there are a few potential long-term issues. If a cat accidentally gets too much insulin, that can cause severe hypoglycemia, which could lead to seizures, blindness, or even coma. That's an emergency.
Okay, very serious.
And over the long term, some diabetic cats can develop kidney problems known as diabetic nephropathy. And that diabetic neuropathy can also persist or develop, affecting the nerves like we saw with that plantigrade stance.
So managing it well is key to minimizing those risks. What's the overall outlook then? What's the prognosis for a cat diagnosed with diabetes?
Well, while some cats might experience that remission, especially early on with diet changes, it's also possible for the diabetes to come back later.
Okay.
But overall, the prognosis for cats who receive consistent treatment is generally quite good.
That's encouraging.
Yeah, with proper management, the right diet, insulin if needed, careful monitoring, those diabetic cats can absolutely go on to live a normal lifespan and have a really good quality of life.
That's great to hear. So, just to kind of wrap things up, the big takeaways seem to be feline diabetes, mostly type 2, is pretty common, strongly linked to obesity.
Definitely.
But the really good news is that it's often very manageable, sometimes even reversible with diet alone, especially early on.
That's right.
And catching it early, consistent monitoring, and working closely with your vet are really the keys to a good outcome for your cat.
Absolutely spot on. And, it really makes you think, with that incredibly strong link to obesity, what are the wider implications of our cats' lifestyles and diets on their overall health, beyond just diabetes?
Yeah, good point.
It just really underscores how interconnected everything is. Their diet, their weight, their activity levels, and their general well-being. It's not just about one disease.
That's a powerful final thought, and definitely a good reminder for all of us cat owners to look at that bigger picture. If you listening are looking for more detailed info or have specific concerns about your own cat, we always encourage you to check out reliable veterinary resources and definitely, most importantly, have a good chat with your own veterinarian for that personalized advice.
Absolutely.
Thanks for taking this deep dive with us today.